Hello again and happy Saturday from Metro Manila, the Philippines, Southeastern Asia. Globally, there are now over 23 million human cases of COVID, including over 6 million that are active, and over 800,000 human beings have perished of the COVID-19 pandemic. But are there ways to beat this disease? According to scientists and other medical experts, yes, there are. They might actually be simpler than we think. One is hand washing. So soap and water have an important part to play in the fight against COVID-19 that is easily forgotten. It is something that many of us do instinctively, almost as muscle memory, several times a day. But rarely has it been as important as it has in the last 6 months. Amidst of weapons against coronavirus, masks, self-isolation and social distancing, one has been particularly easy to overlook: hand washing. In February 2020, as all of us remember, the coronavirus emerged as a worldwide health emergency. Health agencies since then have scrambled to advise people on how to protect themselves from the new virus. One suggestion, repeated day after day on news bulletins, advertisements, and expert interviews, was to wash hands with soap in warm water for at least 20 seconds. The World Health Organization published a graphic, widely memed since, showing the correct way to wash hands, a how-to familiar to anyone who has ever worked in a bar or in a restaurant. 6 months on, the confused global picture over spikes and localized lockdowns like the curfew recently imposed on the city of Melbourne in Australia has pushed the hand-washing advice to the margins. Amid the growing backlash in some quarters against wearing masks and face coverings, this other silver bullet against coronavirus infection has been out of the spotlight. One Ethiopian observational study, still to be peer-reviewed, found under 1% of more than 1,000 people visiting hospitals washed their hands in the correct way. But has the advice changed? Not at all, say the experts. If anything, they have doubled down on its efficacy. Thomas Gilbert, an associate professor of chemistry and chemical biology at Northeastern University in Boston, Massachusetts, United States, says coronavirus's chemical makeup can be disrupted by nothing more specialized than cheap soap and warm water. According to him, these viruses have membranes that surround the genetic particles that are called lipid membranes because they have an oily, greasy structure. It's this kind of structure that can be neutralized by soap and water. Dissolving this outer envelope breaks the virus cell up, and the genetic material, the RNA, which hijacks human cells to make copies of the virus, is swept away and destroyed. I've heard of nothing yet to make the hand-washing time shorter, says Gilbert. What you want to be doing is wetting your hands, getting the soap, and working up a proper lather, and then rubbing your hands for a good 20 seconds and get into all the nooks and crannies. This gives it enough time, according to Gilbert, for the chemical reaction to take place between the lipid membrane and the soap. There are other benefits. It also allows the soap virus fighting happens a little more quickly. Martin Michaelis, a professor of molecular science at the University of Kent in Britain, says water on its own is not enough to disable the virus. When you have olive oil on your fingers when you are cooking it's very hard to get rid of it with just water. He says you need soap, according to him, to remove that lipid envelope so that all the virus is deactivated. Hand washing's effectiveness has been somewhat sidelined due to the wide adoption of hand sanitizers, either the small bottles people take with them out of the house or the stations people are asked to use when they enter supermarkets and bars. According to Gilbert, it's not a bad idea to have something like that in your automobile or inside the front door, because these things are good for when you don't have access to a sink and a soap and water. I would always prefer soap and water to hand sanitizers. So how often should we still be washing our hands? Early on in the pandemic, the British government's scientific advice was that people should wash their hands every few hours. Gilbert says that's not really necessary for those who are mostly staying home during the day, though they should, of course, be washing their hands normally after using the toilet, before preparing and before eating food. If you're at home all day and there's not 20 strangers running through your house, then washing hands just for the sake of it is not necessary, he says. Another paper led by PhD candidate Phai Mui Pham at the University of Utrecht in the Netherlands found immediate hand washing after coming into contact with a possibly infected person or surface was much more effective than washing. Most of the antimicrobials on the market are in fact antibacterials. Washing hands, of course, is a lot easier when you have a reliable water supply to hand. In less developed parts of the world, so much of Africa, or most of Africa, much of Asia, and even much of Latin America and several Oceanian countries, water is a more precarious resource, and in many of those places, public health standards and living conditions are often less than ideal. In fact, just this month, the World Health Organization reported that only 2 in 5 schools around the world, so only 40% of the world's schools, had adequate hand washing facilities before the coronavirus pandemic hit. The coronavirus pandemic seems to have had a knock-on effect on the flu season in the first half of 2020, according to evidence. For instance, South Africa's National Institute for Communicable Diseases, NICD, would normally deal with some 700 cases of severe flu between the end of March and August. This year, they have reported only 1.